Hello everyone, welcome to the channel. On my previous video I talked about our trigeminal nerve including our ophthalmic nerve and maxillary nerve. So if you have not seen that video, then click on the I button and watch that video now. Today I am going to talk about the remaining part, which is mandibular nerve and the function of trigeminal nerve. Okay, now before I proceed further, you need to know about one thing, that our skull, if you look the skull from below, as you can see in this photo, this entire skull has lots of holes. We call it foramen. Now there are lots of foramen. I will talk about these things later. Now there are two foramen are related with this mandibular nerve. One is foramen ovale, or you can say it foramen ovale, but it sounds disgusting, so you should say ovale. Okay. Another is foramen spinosum. Okay. So these two foramens are very important for this mandibular nerve. Mandibular nerve arises from trigeminal ganglion, and after arises, it comes down, or it goes, or it exits from our skull via a foramen which is known as foramen ovale, and just after coming out it gives another branch. It gives another branch which goes anteriorly and upward and enters again inside of our cranium or inside of our skull via foramen spinosum. Suppose this is foramen ovale here and another foramen here, which is this is known as foramen ovale, and the anterior foramen is known as foramen spinosum. So from this side a nerve fiber arises and enters inside of our foramen spinosum again. Now due to the nerve fiber entering into the foramen spinosum, we call that nerve nervus spinosum. That's it. After giving the one branch to the foramen spinosum, this mandibular nerve further descends and one fiber arises from mandibular nerve and it goes to otic ganglion. Now otic ganglion is a group of few neurons together. I will talk about this otic ganglion in ENT chapter. Okay. Now from otic ganglion some extra fibers arises which supplies our medial pterygoid bone. Now in this medial pterygoid there are two muscle associated. Now there are two muscle attached. One is tensor veli palatini, another is tensor tympani. Okay. Now both muscles are supplied by these postganglionic fibers which are arising from otic ganglion, which is a part of mandibular nerve. Okay. otic ganglion का काम खत्म होने के बाद जब ये mandibular nerve नीचे की तरफ बढ़ता है तो ये mandibular nerve अपने आप को दो हिस्से में बांट देता है. ठीक है. एक हिस्से का नाम है posterior part, पीछे वाला पार्ट, और दूसरा सामने वाला पार्ट मतलब एंटीरियर पार्ट. जो एंटीरियर पार्ट है, एंटीरियर पार्ट से आपका चार नर्व फाइबर निकलता है. ठीक है. एक आपका लेटरल टेरिगोइड में जाता है, दूसरा आपका टेम्पोरलिस मसल में जाता है, तीसरा आपका मेसेटर मसल में जाता है, और चौथा आपका बक्सिनेटर में जाता है. ठीक है. और जो पीछे वाला पार्ट है पोस्टीरियर डिवीजन, ठीक है, ये क्या होता है, ये तीन हिस्से में बट जाता है. तीन हिस्सा क्या क्या है. पहला वाला हिस्सा आपका ऑरिकुलोटेम्पोरल नर्व, वो जो आपका पेरोटिड ग्लैंड में आके खत्म हो जाता है. दूसरा लिंगुअल नर्व जो आपका जीभ में आके खत्म हो जाता है. और तीसरा आपका इंफीरियर एल्वियोलर नर्व जो सामने जाके और भी तीन हिस्से में बट जाता है. एक हिस्सा आपका नर्व टू माइलोहेड में जाता है, दूसरा हिस्सा आपका हमारा जो डाइजेस्टिव मसल है इसका सामने वाला पार्ट मतलब एंटीरियर डाइजेस्टिव में जाता है, और तीसरा हिस्सा हमारे ये जो हड्डी है मैंडिबल, इसके अंदर ही खत्म हो जाता है. बस. तो ये होता है पूरा आपका मैंडिबुलर ब्रांच का पूरा हिस्सा. तो कल के वीडियो और आज का इतना हिस्सा तक आपका पूरा ट्राइजेमिनल नर्व खत्म हो जाता है. ठीक है. सो नाउ आई एम गोना टॉक अबाउट द फंक्शन ऑफ ट्राइजेमिनल नर्व. सो इट हैज थ्री पार्ट, as you already know that. One is ophthalmic, another is maxillary, another is mandibular. So first of all I'm going to talk about ophthalmic. Ophthalmic has one branch which is known as frontal branch, and from frontal branch there is two fibers going on. One is supratrochlear and supraorbital. Supratrochlear nerve carries the sensation from our lower forehead area. Okay. This is forehead, is upper forehead, and this is lower forehead. So from lower forehead area supratrochlear controls. Now supraorbital, it controls the above side of our orbit, the upper forehead, this entire scalp, the vertex area. Okay. Now what is vertex, I will talk about this later. Okay. And also there are some sinus, sinus present in our forehead known as frontal sinus. It controls the frontal sinus. Okay. Now another branch of ophthalmic nerve which is lacrimal. So lacrimal gland also carries the sensation from our lacrimal gland. Another is nasociliary. Now from nasociliary one branch arises which is anterior ethmoidal. Anterior ethmoidal supplies our ethmoidal sinus and adjacent area of ethmoidal bone from anterior side. Another branch is posterior ethmoidal. It supplies our posterior part of our ethmoidal bone and sphenoid air sinus. Now I will talk about this sinus very later. Okay, so you got already three sinus. One is frontal, one is ethmoidal, another is sphenoid. Okay, now there is another sinus which is maxillary sinus. I will talk about later. Now next branch is infratrochlear, which supplies the root of our nose, this area. Okay, and last branch is your external nasal, which supplies the external part of our nose. Okay, external part of our nose. Now as I talked in my earlier videos that anterior ethmoidal gives one branch which is anterior nasal nerve, which supplies the anterior aspect of our nose. Okay, only this area. Okay, that's it, nothing else. Now we am talking about the function of maxillary nerve. As I told about that before entering into the infraorbital fissure, it gives one branch which is known as posterior superior alveolar nerve. So it supplies our molar teeth. Next part is your middle superior alveolar nerve, which supplies our premolar teeth. And another nerve fiber is known as anterior superior alveolar nerve, which supplies our this canine and incisor teeth. Okay, this maxillary nerve separates into three parts. One is ganglionic, another is zygomatic, another is infraorbital. Okay, now this ganglionic part supplies the mucosa of our inside of nose, in nasal mucosa, behind of our nose, which is nasopharynx, so nasopharyngeal mucosa, and the mucosa of our upper side, palatal mucosa. Okay, gone. Now let's talk about zygomatic part. This zygomatic part supplies our cheek area muscles. Okay, these cheek muscles. Okay, and the lateral part of our head, I mean the temporal part of our skin. Okay, this temporal skin, this temporal skin. Okay, that's it, nothing else. And now I am talking about the last, which is infraorbital part. The infraorbital part supplies our lower eyelid. Inside of our lower eyelid there is a conjunctiva. Okay, so lower conjunctiva is supplied by our this infraorbital branch and our upper lip. Okay, these upper lip branches. Now this upper lip skin supplies by these infraorbital branches. Okay, that's it. One nerve fiber enters inside of our skull via foramen spinosum, which is known as nervus spinosum, and it supplies the middle part of dura mater. Okay, middle dura mater of our middle cranial fossa, I mean the mid part of our brain, not anterior part, not posterior part, only middle part of our brain, which is covered by dura mater. So this nervus spinosum supplies the dura mater of middle cranial fossa. You already know about that. This medial pterygoid has two muscles. One is tensor veli palatini, one other is tensor tympani. Both muscles are supplied by this nerve to medial pterygoid. Gone. Next is anterior division of mandibular nerve, which is a part of lateral pterygoid. So it supplies the lateral pterygoid. Gone. Another is temporalis. So it supplies our temporalis muscle. Gone. Another is masseter. It supplies our masseter muscle. Gone. Another is buccinator. It doesn't supply our buccinator muscle, but it pierces the buccinator muscle and supplies our inside of our cheek, mucosa of our buccinator muscle from inside. Okay, this. So it supplies our inside of our. So it supplies the mucosa of buccinator muscle. Now the posterior division part. First of all, it comes to our auriculotemporal nerve, which supplies our this temporomandibular joint. Okay, mandible and temporal bone. Temporal bone, the joint between that mandible and temporal bone. Okay, so the joint is known as temporomandibular joint. It supplies our outside skin of our ear. So yes, this ear skin is supplied by auriculotemporal nerve, ear skin. Then inside of our ear there is eardrum, which is known as tympanic membrane. So it supplies the tympanic membrane also. Again, it ends in our parotid gland, so it supplies our parotid gland also. Gone. Next is lingual nerve, which supplies our 2/3 of our tongue. And the last part is inferior alveolar nerve, which supplies our mylohyoid muscle, anterior digastric muscle, and every teeth of lower jaw. From molar to our incisor, every teeth. Okay, every teeth of our lower jaw is supplied by this inferior alveolar nerve. That's it. So now you know that the function of ophthalmic nerve, you know that the function of maxillary nerve, you know the function of mandibular nerve. Okay, so these all three nerves are part of trigeminal nerve. So now you know everything about trigeminal nerve. Gone. That's it. Finish. From next video I will talk about another cranial nerve. But if you like my content, then like it, subscribe it, share it. Till then, bye.